look at some signs. Signs that distinguish the origin of muscle weakness. So what distinguishes the origin of the muscle weakness? So what does this include? So first we are going to look at some upper motor neuron. So we are going to focus only on the UMN. So under UMN, we are going to check if there is atrophy. So atrophy, the answer is none. So what about fasciculation? So under fasciculation also there is none. Then when you look at the tone is spastic. And when you're looking at the distribution of weakness, So distribution of a weakness, you can call it is pyramidal or it is regional. Next, when you're looking at the muscle stretch reflexes, So muscle stretch reflexes, it is hyperactive. Then when you're looking at the Babinski sign, BS, here it is present. This is totally in case of the upper motor neuron. Next, we are going to look at the lower motor neuron. So lower motor neuron in short is known as the LMN. So under LMN, the atrophy, if you see, it is severe. LMN, the atrophy is severe. Then what about the fasciculations? Fasciculation is nothing but it is common. Then when you're looking at the tone is decreased. Then what about the distribution of weakness? Distribution of weakness is distal or segmental. Then what about the muscle stretch reflexes? The MSR there is hypoactive, whereas in case of the upper motor it was hyperactive. Here it is hypoactive. It is hypoactive, or you can call it absent. It is absent. So what about the BS? That is the Babinski sign. Babinski sign is absent, whereas in case of upper motor neuron it was present. Next, we will be dealing with the myopathic. So this is myopathic. So under myopathic, the atrophy will be mild. Then the fasciculations will be none. Tone is normal or it is decreased. So what about the distribution? Distribution of the weakness, it is proximal. And then when you're looking at the MSR is a muscle stretch reflex. Here it is normal or hypoactive. It can be normal or it can be hypoactive. When you're looking at BS is absent. It is absent in case of the myopathic as well as the lower motor neuron. Next, we are going to look at the psychogenic. So we are dealing with the psychogenic. So under psychogenic, the atrophy, it is none. Fasciculation is none. Tone is variable. Tone is variable as well as there is parotonia. So what about the distribution of weakness? Distribution of weakness, it is variable. It is inconsistent. And this is with the daily activities. Inconsistent with the daily activities. Next comes the MSR, that is the muscle stretch reflexes. This is normal. Then comes the absent. So BS is Babinski sign. Babinski sign is absent. So this was a topic on the signs distinguishing the origin of different muscle weaknesses. So to learn and grow daily like this, please do subscribe.